Who are you? What's your, really what's your superpower, and why should you win this award?
My name is Antoine. I lead Withings healthcare division. For those of you who don't know us, we invented the smart scale 16 years ago, and we've been bringing connected health devices to the market since then. We've helped about 10 million people on their journey to better health since our inception through a wide ecosystem of connected health devices. We expanded in the healthcare space 5 years ago to help care team remotely monitor their patients. And what sets us apart, why we think we should win, is really our deep understanding of consumer behavior. We come from the consumer space. We understand the end user. We understand what makes them tick. We understand how to find our way into their daily routine and bring this data back to care teams.
We want to know, like, what is going to be what's the big change? What's the big impact your company is going to make on patients in this space? If you are, I mean, I know most of you are successful already in different ways, but again, like, what is going to be the biggest long-term impact that you're going to look back and go, we did that?
The biggest impact, and what we look back and say we did that, is the impact we had on early prevention, on prevention and early detection and diagnosis, on pretty much the entire care pathway to enable both patients and care team to better understand what happens in their daily life with a variety of chronic conditions. We have solutions for pretty much every single chronic condition you can think of to help them see this rising risk, better diagnose earlier, understand the complications. So really think that our long-term impact will be in helping to prevent chronic conditions and their complications.
What data are you providing? What evidence is it that's really resonating with the person who's writing the check, whether it's payers or somebody else?
Yeah, for me, the evidence is about being able to generate data in the long run to empower these care teams to understand what happens with these patients. If you look at Withings' history, we've helped 10 million people on their way to better health. We've detected 2 million episodes of AFib, for example. Researchers have used our devices and our data to demonstrate the variability of AHI in sleep apnea. Over 60,000 users in a published study. They have analyzed 12 million nights to show that the likelihood of misdiagnosis in people with sleep apnea can range between 20 to 50%. So it's really about how do we use this data to demonstrate the impact we can have, but also on the care team side. So in the healthcare space, how do we empower these care teams to deliver better outcomes? So it's not us. It's us empowering great people to do great things. And if I think of a few hospitals we've worked with recently, some of them have decreased systolic blood pressure by 20 millimeters of mercury around the high-risk patients. I was talking to another one that that saved 1,300,000 PM in their ACEO population after a CHF program was implemented. So it's really about showing both better outcomes for patients and better economies and financials for the system.